Welcome, everyone. We're here today with Paul Nemi, and I'm going to ask him to introduce himself.
Hi, how are you? I'm Paul Nemi. I'm a nurse practitioner at the Valley Medical Center Urology Clinic, and I specialize in men's health issues.
Great. Thanks for being here, Paul. Today, we're talking about erectile dysfunction and other men's health conditions. So let's start with our first question. What is erectile dysfunction, or ED?
It's a difficulty or inability to achieve or maintain an erection. Can vary in severity and can affect patients of all ages.
What are potential causes and risk factors for having ED?
There are multiple chronic medical conditions that people have that could be risk factors, such as chronic kidney disease, high blood pressure, high cholesterol, chronic heart failure. There's also hormonal abnormalities. Different medications that patients on could have that as a side effect. There's also the possibility of psychological factors that come into play, and it's often multiple things at once that are leading to the erectile issue.
And how common is it?
Well, it's a common problem among both younger and older men. Now, while the problem does increase as patients get older, again, with the different factors that can lead to erectile dysfunction, it's not an uncommon thing with even younger men as well.
And for men who are maybe a little worried or even a little ashamed about having ED, what would you tell them? What advice would you give them?
I'd encourage them to, seek help and reach out to a provider to discuss this with, especially at our clinic. This is something we deal with on a very regular basis. There's no reason to be ashamed, and it's something that, if addressed, especially early on, there's many medications or treatments that are available to help the problem.
And so mentioning that there are many medications or options, what are the options for ED treatment?
There's several oral medications that are on the market. While they used to be quite inaccessible due to cost in the past, we have ways to make them more affordable now. Even if you don't have insurance, we have ways of making sure that these medications can be easily affordable. The medications are used on an as-needed basis. One of them has the option of a daily dose as well too, so it's always in your system. There's injectable medications and then several devices that can be used as well too. There are more advanced treatment options, such as surgical implants of a penile prosthesis. And if that was something that a patient was interested in, we would be able to refer up to some of our partners at the University of Washington for that as well.
Okay, great. So in your men's health care services at the urology clinic, I understand that there are other conditions you treat. What are those?
Yeah, absolutely. I also treat patients with low testosterone or hypogonadism, premature ejaculation, urinary symptoms associated with an enlarged prostate, as well as several others.
Great. And how do patients schedule an appointment with you?
You could first reach out to your primary care provider if a referral is needed for your insurance. If you feel comfortable starting this discussion with your primary care provider, you could always do that. If not, I'm always happy to see patients and be their first point of contact when it comes to ED treatment options and workup. And you could contact our clinic for that as well too, to schedule an appointment with me.
Great. Thank you so much for answering our questions today, Paul. And for those of you who are watching, we'll have information about the Urology Clinic website and phone number in the details for this video.
Yeah, absolutely. Thank you.